When a young girl gets pregnant in our communities, they have options are usually few, if not none. More often than not, she drops out of school. After dropping out of school, she's forced into a marriage. If not forced into a marriage, then she brings up a kid as a single mother, and this is a teen mother in this case. Once out of school, then she cannot pursue her career choices, and typically leads back to poverty. So it simply perpetuates the cycle of poverty.
The Youth Peer Provider Program is a program model that was developed by Planned Parenthood Global, and this is a program where young people are trained and managed to provide sexual and reproductive health information as well as services to their peers.
First, I want to thank Ms. Coach Kenya because they have helped me to gain a lot of skills and knowledge. And second, what makes me happy so much is that most of the people, when they have problems, they can come and open up to me.
So the benefit of a young person talking to a fellow young person in this case, there's that acceptance because of the age bracket. They belong to the same age, they understand one another in terms of language, and you see the youth peer providers, they also experience some of these problems the young people undergo.
In our case here in Kenya, they have established the relationship either in the fields as they play football, or in schools because they are in school together, or at the community level where they are offering services.
The Youth Peer Provider program has really helped me as an individual because I got exposure, I got to interact with many people. It built my confidence.
Once you empower them, once you give them that information, through training, through enabling access to information, through participation, enabling them to participate in what we are doing, they change and they do very well. When you listen to their stories, you get amazed by how much information can change a person.
My fellow YPPs are very courageous people, very reliable, very committed. We work as a team, hand in hand, to help our fellow youths.
Our goal is that other organizations can see this as a program model that they can actually adopt and implement so that the Youth Peer Provider Program will not be considered as a novelty. It will just be a normal part of youth having access to sexual and reproductive health services.
The YPP model has been described variously as life-saving. Some quarters think that it's a fresh idea in the communities that we work with, but most importantly that would not respect the reproductive health rights and choices of young people.
What I think is the vision for the future in terms of young people's access to sexual and reproductive health services is first to have an environment where adults in particular are supportive of young people. They understand that this is a normal part of human development and that young people's access to sexual and reproductive health information and services will be as important as young people's access to basic education.